It is tough times in New York, particularly at the moment.
It is, Tim. It's really quite scary here at the moment. The streets are completely empty, but the sirens, which are part and parcel with living in New York, have increased significantly. They're pretty much constant now. The hospitals are overflowing, the morgues are overflowing. There are pop-up mobile morgues in various streets throughout Manhattan and in Brooklyn as well. It really sort of signifies where this is all headed, and that's also really one of the most concerning parts about it at this stage.
Are many people thinking the worst is still to come in New York?
We're told that it is. We've heard this from all of the authorities speaking on the matter. They're saying that D-Day is expected within the next 7 to 30 days. They're expecting mass casualties. They're saying that, and this is a total for the complete scenario, but they're saying that if 100 to 250,000 people die in the US, that's a good outcome. There have been some projections for the death toll in the US alone to be between 1 and 2 million, which is also extremely concerning. It's getting to the stage now with most people who live here now know of several people at least who have contracted the virus. I know a few that have, and it's certainly not just the elderly or the vulnerable. A lot of people who are young, fit and healthy are in ICU, some fighting for their lives at the moment. And, I think that's also the scary part, is that this is not the situation that a lot of people initially believed that it was. It's far more serious. Very evident here.
Yeah, well, that's it. And it's policy on the run, isn't it? We just heard from Trent in the United Kingdom, where 2 mothers in their 30s have passed away, 2 healthcare workers. Are people listening to what's coming to them regarding social distancing and staying away from everything and following basically the rules?
Look, the majority are. Again, the streets are completely dead, but people are still allowed out for solitary exercise. And, I was on a run yesterday and people were running really close to me, and one coughed, which was concerning in itself. But not everybody is really steering as clear as what they should be, but the majority certainly are. The parks, which this time of year normally start filling up with people having picnics and drinks and in groups, are empty at the moment. So that's a good sign. But, even with the necessities like shopping centres and places like that, you see huge lines wrapped around blocks waiting to get inside. Most of the people spaced out with the 2.5 metres distancing in these lines, which is why they're so long. But, there's still risk everywhere, and as we go from one day to the next, that risk is certainly increasing.
Dr Anthony Fauci, who's seen as one of the great medical minds of the world, and this is his area of expertise, he has come out and said that every state in the United States, all 50, should be following the same guidelines, and he's bemused, or he can't understand why they aren't.
Look, there has been quite a lot of back and forth between state and federal governments. A lot of people are saying that there should be a sort of a coordinated national response to the coronavirus pandemic in the US. At the moment, states are largely being left to their own devices to come up with their own strategies and plans. So there are a lot of differences from one state to the next. New York is obviously under a pretty heavy lockdown at the moment, purely because of the sheer number of cases and the population here. But there still are a handful of states that are not in any sort of lockdown at all, despite still having cases there.
Look, it is so out of the ordinary what's going on. It is a once in a 100-year event, what we're seeing, but normally at this time of year, in an election year, that would be dominating all the discussion, and it's just been pushed right under the carpet. What's the buzz on the street over there politically?
Look, the election's really being impacted. I mean, we've just had yesterday, it was confirmed that the Democratic National Convention will be moved from July until August because of this pandemic. It's posing a lot of problems over the coming weeks and months for campaigning, that we're probably going to see a lot of changes there. And there's even the possibility at the end that the US has some sort of a virtual election if we can't get this under control before November. So there's certainly a lot to assess and look at, but at the moment a lot of it really remains unknown. I think the next sort of couple of months will be quite critical in seeing where that's all going to end up.
And reading the newspapers, Donald Trump, the president, has taken a bump. He's had a bump in his popularity.
Look, he has. It has otherwise been going up. So I think for him it'll be a bit of a hit to see that. But he has been copping a bit of criticism for his handling of this pandemic. He started off saying that it was a hoax designed by the Democrats to damage his campaign. He's now backtracked on that and is saying that he's always taken this seriously and had obviously enacted the $2 trillion economic relief package as of last week. So we have seen a big change in his tone along the way, but not everybody's forgotten how it started.
Meg, what about on a personal level as an Australian in America amidst our expat community? I suppose at times like now, Australia seems a long way away.
It does. Look, there are still quite a lot of Australians in New York at the moment who live and work here. A lot did go home when the Australian government advised them to do so, but others had their entire lives here and instead decided to wait it out. And there's a lot of concern for some of them who have since lost their jobs. They don't know if they're going to be able to make it home, or if they do, if they can get back to their lives here. Because of the health system here, they were also quite a lot worried about whether or not they'll have the appropriate coverage, or if the health system here is even equipped to be able to help them as it would in Australia if they do get sick. But it is scary for that reason too, particularly while hospitals are overflowing and you're not sure in the coming weeks when we reach the apex if the help is going to be there.
Finally, that is the issue here, one of the issues, isn't it? As one of the most powerful countries in the world, the health system is shambolic.
That's right. And I mean, at the moment, the authorities are calling for doctors from all over the country to be drafted to come to New York and help here first while it's the hardest hit state in the US. What they're proposing is that if we can get as much help here now as we can, that then when this virus ramps up in other states, those people and the facilities and the supplies can all then be moved there. But of course, that only works if we can get it under control here before the next state is really just as badly affected as New York is at the moment.